As I said, welcome. Today we have a very interesting webinar. We will discuss the role of machine learning in biomechanics, power, precision, and critical thinking. This webinar is going to be recorded and it will be uploaded later on to our YouTube channel. Please subscribe and then you won't miss the recording of this webinar and any other webinar in the future. You can also check webinars that we have in the past. Before we move to introduce the speaker, I want to introduce us, the chairs of this webinar. Yeah, sorry about it, but I will start maybe with myself to follow the order. My name is Laura Lafuente, and I am a PhD student in KU Leuven in Belgium, together with Gianluca from the Sapienza University of Rome in Italy. He's a postdoc there. We have been chairing the ESB webinars for the last, I don't know, 1.5 years. But since we have been now almost 4 years in the ESB student committee until now, we have changed the name to Early Career Committee recently. We will soon have to leave the committee. So I will already introduce you the new person who will be taking over the webinars. And this is our colleague Alessio Amicone. Alessio, would you like to introduce yourself?
Sure. Hi everyone. Thank you, Laura, for the introduction. My name is Alessio Amicone, and I'm also part of the ESB Education and Early Career Committee, formerly known as the ESB Student Committee. Yeah, I'm originally from Italy, and currently I'm a PhD student at ETH Zurich in the Institute for Biomechanics, working in Ferguson's lab, and yeah, I'm also in the committee since 1.5 years. And I'm really excited, as Laura said, to be stepping into the role of webinar organizer, as I see is a fantastic opportunity, of course, to foster knowledge exchange and bring our community closer together. Thank you for joining today's webinar. I have to say it's really amazing to see such an incredible number of attendees today. So thank you for being part of this. And it's truly a pleasure for me to introduce today's speaker, Dr. Matteo Tanadini, someone I had the privilege of learning from during the Applied Biostatistics course at ETH Zurich. And if you ever had the chance to attend one of his lectures, of course, you already know that the way of explaining complex statistical concept is brilliant. So yeah, just like a bit of background of Matteo. Matteo academic journey is impressive, and he studied biology at the University of Lausanne, but his deep passion for statistics led him to pursue a master in statistics at ETH Zurich. After gaining hands of experience in statistical consulting at ETH, he took his expertise to the University of Oxford in UK, where he earned a PhD in applied statistics. Matteo, then correct me if I'm wrong. Beyond academia, Dr. Tanadini has worked also as a data scientist for multiple consulting firms before founding his own data science company in 2020. His work focuses on statistical modeling, model validation, and modern parametric models, with extensive expertise in the statistical software R. Currently lectures at both ETH Zurich and University of Oxford, bringing together academic rigor and, of course, real-world application. Today, as Laura mentioned, he will be guiding us to an exciting discussion on the role of machine learning in biomechanics, power, precision, and critical thinking. So before we begin, let me quickly explain how is working the webinar. So Matteo will present for around 45 minutes. After that, we will have a question and answer session where you can ask your question. Feel free to type them in the question panel, not in the chat, please, at any time, and we will address them at the end. So just say, please join me in welcoming Matteo. And Matteo, the stage is yours.
Thank you very much, Alessio, for the kind introduction. I'm gonna share my screen, and you see my slides, right? Not yet. You now see them, right?
Yeah, we can see them now.
Excellent, thank you very much. Okay, so yeah, I can't. Okay, just need to minimize the window. Sorry, just a second. Okay, thank you very much for inviting me and giving the opportunity to talk about what we do every day. So machine learning and applied to many different fields. It's nice because, you know, when Alessio first contacted me a few months ago, he said, you know, there's going to be 20, 30 people. And now I see that there is currently more than 100, it's 140 now. So it looks like there is a kind of a lot of interest in this topic. So it's a pleasure to be able to talk about this. Today, as you say, I'm going to talk about the role of machine learning in biomechanics. And essentially, I'm going to talk about what is the power, what are the limits, and actually, it's more about what's your role as a researcher, either in academia or industry, to use machine learning to, you know, come up with good stuff, valuable results. And you can already see from my subtitle why thinking still matters, where I'm going to go today. Now, the introduction I want to make today, it's that actually you know a lot about me, and I'd like to know a bit more about you. Because usually, you know, as Alessio said, when I'm teaching at ETH or any other university, it's for me very important to know what's my audience, to make sure that I have them on board and that they follow, and I can also adapt my language and use it in appropriate language. So I would like you to first answer a poll which says, okay, the question is, to what extent do you use machine learning in your work? So I don't know, yeah, poll. Organizer must close a poll. So I guess are you seeing the poll now? I don't.
Yes, they are answering too.
So as a presenter, I just assume I don't see it. But then how can I see the results? Let's see. Okay. Laura, I don't see the results. Is there a way I can see the results?
Yes, you need to go to the tab polls, and I think you could see it.
Unfortunately, I as a presenter now, I don't see it anymore.
Okay, I can tell you the results if not.
Yeah, will be. Okay.
Winning 37 rarely, 33 not at all, and in the third place with 19% moderately.
Okay, thank you for sharing the result. That's very interesting. So there is also, in terms of attendees, there is a kind of a mixture. So it's not just people interested in machine learning or using machine learning, but it's more a general. That's very good. So I was maybe expecting more people interested in you know, machine learning and use machine learning extensively, but that's not the case. That's good to know. So I go with the second question, and which looks more about the future. So I'd like to know from you, how central do you think the use machine learning will become in biomechanics over the next 5 years? So to essentially say, well, how do you see the potential of machine learning in the next few years?
%80 of the people have voted now, and as a winning option with 48%, we have highly central.
Okay.
With 36, moderately central, and with 11% fundamental. Okay, thank you very much. So again, I mean, it looks like it's you all think that it's something that's going to play an important role. I think we cannot see the slides. You can't. Okay, I need to share them again. Okay, is that okay? Yeah, now yes. Perfect. Okay, thank you. Very good. Now, I kind of know where you are, at least a bit. And now I'm going to make a claim, which we will then essentially discuss during this presentation. And it's that to harness the full potential of machine learning, it's very simple. You just simply need to, or let's simplify things, but you just simply need to collect loads of data to run several machine learning algorithms, you know, try different methods, and then pick the best performing one. So this is essentially
it's simplified, but it's all what you need to do with machine learning. Now, I'd like to ask you a question. So that's the third poll, and it's the last one, so no worries. To what extent do you agree with this claim that to harness the full potential, we just need to go through these 3 steps, or essentially just go through these 3 steps?
Maybe you can remind the claim, since we cannot see it with them.
Right. Okay. To harness the full potential of machine learning, you simply need to collect loads of data, run several machine learning algorithms, and pick the best performing one.
Okay, 80% of the people have voted now. And we have with 32% vote, just change to 31% agree, 29% disagree, 19 neutral, 12 strongly disagree, and the rest strongly agree.
Okay, I go. That's good. I go with the strongly disagree. So you will see during this talk why I strongly disagree. But if you did so and you felt like I'm not fancy, I'm not cool now because I'm saying it's not that simple, just be reassured that I'm with you. And I'm going to bring now, go through 3 examples to show you actually why it's much more than this that you need to do. And then we can discuss at the end whether you still have the same idea, whether you change your mind. Before going to the examples, I'd like to briefly introduce the company I'm working for, I'm running. Just gives you also some feedback. As the name says, it's a data science company based in Zurich. It cannot be different, right, because of the name. Just to give you an idea of what clients we have, we work with private companies, which can go from pharma to food producing companies to services companies, anything. We work with cantons, we work with federal offices. We work a lot also, what's I guess relevant for many of you, with research groups as an external company. And also we are involved in teaching. So essentially we're 6 people and all of us teach in a given university. As I said, for me, it's ETH and University of Oxford currently. And we apply our methods to a very large variety of application fields, and biomechanics is included. We had many projects in the past, and we have a few ones running right now. So today I'm going to go through a few of them that are relevant for you. I try to select 3 topics that I guess are relevant for biomechanics, such that hopefully everyone gets its field at least a bit covered. Now, the first use case is about knee osteoporosis. So obviously this is at the intersection of medicine and medical research. And I'll show you now, this first line here would show you what's the power of machine learning. So you see on the left, very left side, left-hand side, you can take MRI scans. You know that if you've got problems with a knee, you're probably going to go through an exam where people then create some images. These are MRI scans, and you might create many of them. You can create them at several levels. If you're a patient, you can do this several times. And you can use machine learning to analyze these images and come up with the number of lesions you've got in your knee. So you can then also derive a severity score. But the magic here is, from very many images that would take a lot of time to rate, with a machine learning, with a trained machine learning tool, you can go to these lesions, and then with another machine learning step, you can compare treatments. So you might say, now, based on the lesions I've seen, or the lesions are produced by my machine learning tool, I can compare different treatments. So there might be treatments which are drugs, it might be physiotherapy, it might be strength training, might be different things. And you might want to compare them and then be able to come up with claims like, on average, the best treatment you can do for this knee osteoporosis it's, you know, take this drug and do this amount of physiotherapy. So this is what you would see and expect from machine learning. It really looks good. Now, there is actually an issue in the second step. If you use lesions to compare treatments, there is a problem. I'd like you, if you could please write in the chat what you think could be a problem in using lesions and then compare treatments to select which treatment has to be recommended to patients. It's maybe more a field specific issue, but I guess some of you are working in similar fields and then so might be able to spot the problem. If you can write anything in the, I mean, obviously it's going to take a few moments, but if you could write in the chat what you think could be the problem. We haven't tried this yet, so I don't know whether it is going to work. You know, as every course, when you do it the first time, things work and some things do not work. In my chat, I don't see any answer. So I guess there is no answer yet. Is that right, Laura? Or is there the second chat with questions you mentioned before?
There are no questions in the chat indeed, okay. But someone has answered in the question. I don't see the question dedicated panel, but yeah, I can. Yeah, actually, some people are indeed answering there.
Okay.
Can you see that?
No, I just see the chat, and it says actually we will start shortly. So it's not up to date, so to say.
Yeah, so maybe for the next one, we can, for during the webinar, people can answer there, but I can read them to you very fast.
Yeah, maybe.
So the answer, is they say that there are small lesions, small lesions have a better outcome. Also, like this, the treatments will be proposed based on differences in patient anatomy instead of in the lesions. Yeah, there are some indeed talking about that depends on age, gender, and other specifics to the patient. Lesions might not correlate to the patient's symptoms.
Yeah, that's okay. They got it. Thank you, Laura. So this is that's the point, right? The lesions visible in an MRI scan are not a good indicator of pain or impaired quality of life. So the point I want to make here is that you can have a patient that has lesions in the knee, and if you look at the MRI, you would say they're not even able to walk, but they feel well. There is no problem. So here, it's one of these typical, let's say, projects where you can do something super fancy with machine learning, and you save a lot of work. Then people shouldn't then rate these images and these kind of things, but you forget the central point. The central point here, it's patient welfare, and you want to achieve this. So I would go and say, look, if you see lesions, I don't want to pick the treatment that improves or decreases the most the number of lesions. I want to pick the treatment that is most beneficial to people. And this means I want to look at pain, I want to look at quality of life, I want to look at other relevant things. So here in this case, you can train a model that classifies MRI scans that achieves a super good accuracy. So it performs super well, but its practical usefulness is still very uncertain. So you see this mismatch between what you need and what you produce. And I think this is something we see quite often when we come into new projects, that we have to say, okay, but what exactly do you want to achieve? So I'm going to come up with a learning for each or several learnings for each of these use cases. And here the learning is like field knowledge is still essential to fit meaningful models, and to come up with relevant claims. So this is to say, it's not as simple as just picking the best fitting model. You need to think a bit more than this. And then the second thing I'm going to tell you is this ZS recommendation, because we were told there's going to be very many PhD students. We would like to give you some recommendations how to put into practice this learning. And the idea is you really need to be curious. You need to ask questions. So to make an example, once we started a project with food producer that wants to deliver food to very many different places. And one thing we did at the very beginning of the project was just sit in a truck with a truck driver and go through the path that they need to do to see what actually it's happening when they do this. And we learn a lot of things, and then when you model the data, you understand the data, you understand better what you need to do, and so on. So really this being curious, it's something we feel it's still very relevant when using machine learning. And again, here, it's not just about picking the best performing model. Here we highlight the importance of critical thinking. And if we can give you again a recommendation, it's that sometimes you need to challenge the ML omnipotence. So ML is super powerful, but it's not magic. So from time to time, we also get asked for our colleagues, which are researchers. They say, look, there is this Nature paper. They did a super fancy thing with machine learning, with data from very many different sources. What do you think about? And very often we have to say, from the technical point of view, it's super interesting, super complex, but there is a couple of assumptions that then, kind of like you should also consider. So the first learning here is really field knowledge still matters. And now we're gonna go to the second one, to the second use case. And this is about sports and when things go wrong. So here, so I love sports. So that's why I also said it's relevant for you, but it's also something I'm very interested in. I'm a passionate trail runner. You see me at the top of a mountain with my brother. And in that case, nothing got wrong. I mean, now afterwards, I'm gonna talk about injuries. Here, there was no injury. The only problem we had, as you can see, was a foggy day, and we essentially were not trial runners, but we are trial searchers because we had to find the path, and it took us quite a lot of time. Why sports? Also because we worked on many sports projects, and I also acted as a guinea pig, in my years at the university, cycling as long as you can and this kind of things. Yeah, so it's an interesting topic for me too. And as I said, things can go wrong. So you can have injuries when doing sports. And one thing that we looked at, we collaborated with a team of doctors. It's about ligaments, and ligaments, as you know, they can break. And in this study in particular, we were looking at two types of replacement for ligaments. Let's say an old one and a new one. The claim the doctors made and wanted to sustain with data was that the new material lasts longer, and therefore it has fewer ruptures. So you do the surgery and then you have no problems anymore, essentially. The study design as conceived was you have 100 patients with the old treatment, 100 patients with the new material, with the new modern material. And when you look at the results, you know that you have 100 people in both groups, and in the old group, let's call it old, 7 people had a re-rupture, so the artificial ligament that breaks again, so broke. And in the new group, it's only 2 people out of 100. Now, what is the issue? I'm saying that actually it's unfair to compare these 2 groups of people and draw a conclusion from these 2 numbers. Now, again, I'd like you to write, I don't know whether in the chat, because my chat still says we'll start shortly. So I don't know what's the best way, but maybe, yeah, just maybe if you write it again in the questions, and then Laura, if you would be so kind to tell me what people write. Actually, yeah, I see Laura yours. Now it's, yeah. So again, the idea is you got 2 groups. One uses a technique that is there since a long time, and the other one uses a technique that it's fairly new. And you want to know, you should tell me why this is unfair to compare these 2.
Sorry, a lot of people cannot write in the chat, so maybe just type in the question and Laura then will read it.
Okay, apologies for this. I'm more used to Zoom. Yep.
Yeah, indeed. I don't know why other times it was possible. So Anyway, we have some answers. Yeah, one is here saying, well, depends on how the groups are made. It's only fair to compare if the treatment is randomized. New materials don't have historical data. Need to consider the percentage of rupture regardless of the treatment. The user of application, the use or application of the material might be different, so the outcome will be affected too.
So it's actually all fair points you raise here, and you see again how much thinking is involved. Actually, I can tell you now in this specific case, the issue is that the old material patients, they've been around for way longer. So you got the first, I didn't tell you on purpose, obviously, the first patient with old material, it's in 2008, and the first patient with the new material, it's just 3 years ago. So you see that you're comparing people that are on average around since 10 years with the artificial ligaments against people that on average are these ligaments since a year and a half. So obviously, you know, it's not fair because the chances to break these ligaments are fairly low for those people that just got the surgery. Now, I'd like you to tell me, because these two cohorts of people, they cannot be compared directly, because, you know, as I said, let's say the exposure time is not the same. How would you overcome this problem? Again, if you can write in the chat, I can't see it. Sorry if Laura would be, again, so kind to let me know. But the idea is really, okay, how can we make these two groups comparable?
We have some answers already. Compare them in the same factor, compare them in the same time frame, and then include bias factor, compare survival rates, match the participants.
Okay, yeah, that's all good question, good answers, good points. So two of them, I'm gonna go through them here. Actually, two were mentioned. That the better approach is to compare the two treatments in a time frame that you can compare in a fair way. So what actually was proposed by the team of doctors is that they say, yeah, no problem. We always have this problem. You just compare the two treatments after 1 year of surgery, because the newer group, you know, it's very modern, it's very recent, so we don't have that long time frame. So let's say 1 year. This is a fair comparison, but there is a problem. You essentially have no re-ruptures at 1 year, because obviously if you break a ligament, then for the first 6 months, you're not gonna do, you know, very dangerous things and stuff. So you're probably not gonna break it again. And there is a data, let's say from my point of view, from the data scientist point of view, there is a huge data information loss. So if you know that for these old patients, on average, you got 15 years of information. If you focus on the first year, you're just discarding 14 years of observations or information. So that's you know, that's a very killer, that's a very important point here, that you do not want to lose information just to make things comparable. And then the last point, because, you know, we care a lot about practical outcomes. If I'm a patient and you're proposing me two different materials, and you're a doctor and you tell me, you know, after 1 year, the new material, they have a 1% re-rupture, and if you use the old material, there is a 2% re-rupture rate. As a patient, I would say, I don't care about 1 year. I just want to know whether I need to do this surgery again. And why 1 year? I mean, 1 year, and then you talk about 1 and 2%, very small percentages. That's not relevant. So you see here that we have a problem of information loss, and we have a problem that what we say might not be absolutely or totally relevant. Some of you mentioned the better way, and the better way in this case is not field knowledge. The better way with this, deal with this, it's to consider the real nature of the data. So this means consider all information contained in each observation. If you've got a patient that after 15 years had no re-rupture, this is information. If you have a patient that after 15 years had a re-rupture, you can consider this information, say it took 15 years to get a re-rupture. And in the other case, you say it took 15 years, to get to a stable situation. There was no re-rupture yet, but it could happen in the future. But at least knowing that for 15 years the thing worked, that's also very valuable information. You might know, certainly the people that mentioned survival analysis mentioned know that we are talking about, in statistical terms, about sensor data and survival analysis. So the idea here is use appropriate methods. So you should see this problem, you should frame this problem as a time to event problem rather than a probability of something to happen, which is a slightly different problem formulation, but it allows you to use the whole information, and also I'll show you to come up with better claims. Modern machine learning techniques can deal with this. It's a method that it's around since many years, this survival analysis, but you also have nowadays very modern methods that are with a great potential that implement this this type of method. Now, the claim you can make if you use a survival analysis, it will be the average time to re-rupture. Now, I'm a patient and you tell me, you know, on average, this material lasted for 5 years and the new one lasted for 15 years. This is something tangible. This is something I want to hear as a patient. That's much more interesting than the 1 year. And the good thing when you don't discard data, use the whole information, is that you can go back to other things, to simple or more specific results. So you can use this model to make a prediction to any time point you want. So if you still want to say something about 1 year, use this model and come up with, after 1 year time period, you have this percentage of re-rupture. But you can do this also for 2 years, 5 years, 20 years, whatever you want. So you see that you can come up with claims which are much more relevant in practice. Now, so what's the learning? The learning is that you need to recognize the nature of the data, consider the goals of the project, and then you choose the algorithm. It's not that you just try out many different algorithms and then you pick the one that performs the best. It's a different approach and it's much more powerful. And this highlights the importance of this, what we call data literacy. Data literacy means that you need to know a bit, to say it simple, you need to know all what is, you know, around data and its use. What does that mean is that you don't need to be an expert in statistics if you use machine learning and obviously machine learning. You don't need to know how the algorithms work. Also, very often when we work with clients, we want them to become more data literate, because then it's much more efficient to work, and that's also why they pay us for. But the reason is that the idea is that I'm not going to tell them I'm using random forests, which is composed by trees, and it works like this. I'm going to probably going to use random forests with just these pros and these cons. For example, just to mention one right now, it's if we use random forest, it's going to be very flexible. It can handle nonlinearities. It can handle interactions. But maybe it's not the best one for extrapolation far away from where you got data. So I'm going to tell them and explain them what can you do and what you can't do. And this is also what we suggest everyone working with machine learning that does not come from you know, a formal background in data science, what would we suggest to do. And now again, for PhD students, or I mean anyone, but maybe especially for PhD students, it's the recommendation is to get exposed. So attend machine learning courses. There is plenty of, you know, postgrad education, diplomas. And also you can get advice. For example, ETH has a statistical consultancy service where you can go and discuss all these topics, and also work with professionals, data professionals. So this is probably a very good way to, you know, become more data literate. And the second point I want to highlight here, which I very much like, which we really enjoy in our work, it's the importance of being creative. So very often you want to do, I mean, as a researcher, you never redo exactly the same research that you or someone else has done, right? So it's always new questions you want to address. And that's why you need to be creative. So you always have to go like, okay, we would like to show this. We would like to have data to be able to get an answer to these questions. What's the best way to get there? And here we really need to be creative. We are extremely creative in our work. And this is a very important part of the added value we bring to people we collaborate with. Because you always have to come up with new ideas, and this is a collaboration. So we always come up with these ideas with the people we work with. And if I can give you maybe a bit of cheeky recommendation to PhD students, if you ask people, okay, this is the design, this is how we collect data, or this is how we're gonna analyze the data, and you ask why, and the answer is because we always done like that, then this is a red flag. There you should really stop and think, okay, does it really make sense? Because as I said, when you do research, or this applies to industry as well, you don't do the same thing twice, right? So if you're doing something slightly different, maybe you want to optimize different things, and that's why you shouldn't just redo the same thing. We see this quite a lot. There, especially in research, I would say, where you come in and you say, you know, it's a pity that you didn't talk to us 2 years ago, because you could have modified the design, you could have modified this. And then you say, why did you do so? And the answer is really often, yeah, you know, we always done like this. So this is something, it's something I would strongly try to avoid. Very good. Now let's go to the third use case, which is a bit shorter than the other ones. And it's about ergonomics. And it's about classifying seating posture. In short, this project was about a chair equipped with sensors that uses machine learning to classify the sitting posture. So the design is you get volunteers to sit in 8 predefined positions on your chair. The chair is equipped with 20 sensors. Some of them are, you know, pressure, some of them are movement, some of them are acceleration, different types of sensors. And you train this model, you pick the best performing one, and accuracy, it's 99%. So wow, very good. Now, I have to say something about this project. We collaborated in developing the machine learning algorithm, but not in the implementation. Everything I'm going to say right now, it's about implementation, so it does not refer to the real project we worked on. And this is a kind of a Frankenstein example where I take parts of different projects, but I can tell you I selected this one because I know that sensors are something relevant in biomechanics, and we work a lot or very often with people that have projects with sensors, and the issue I'm going to raise is something that we see all the time. So back to the example, the model achieves, let's say, almost perfection. So it's a very good model. Now, would you go ahead? Now you're in a spin-off. You are you're an entrepreneur. You want to produce this chair. People tell you, you know, it works very well. You sit in a chair. It tells you how you're sitting, and this is what you want to know. Would you go ahead and produce the chair? Now, I'd like you to think about very practical implications of this let's say case. And again, if you could please write them in the chat such that Laura can then make a summary. Are there any answers, Laura?
There is one question. What is this for?
Yeah, good question. I forgot to say this. Actually, it would come on the next slide, but you're very good.
And also, yeah, sorry, because I was reading another one.
Yeah. The idea is you need to know how you're sitting, because at the end of the day, you look at your tablet, whatever, and it tells you you've been sitting so many hours, you've been sitting with, you know, legs crossed, you've been standing for so many hours. So it's like to know how you're actually dealing with your chair. Good question.
There are two answers.
Yeah.
One is they need to test in a real world setting, people not performing an experiment. Also, high accuracy on the training set, but not on the real data.
Yeah. Okay. Thank you. Yes. Yeah. This is more the data science focused. Here, I want to go to something much more practical, and the sensor costs. So if you produce a chair that has 20 sensors and you got 99% accuracy, one thing you can do with data is to simulate situations where you only need 5 sensors, 10 sensors, 15 sensors. And which sensors? The pressure ones or the more costly ones, the acceleration ones? And now the idea here is like 99% accuracy, it's great. But again, here, the focus is just, I want the best performing model, and it's not what you should do. You need a useful model. So the idea would work a bit differently. You ask yourself, what is an accuracy? It's okay for us. And I can tell you now in this project, if all what you need is just a summary of the positions at the end of the day, you've been sitting 10 hours out of 15 hours, whatever, then you don't need to be super precise. You don't need every second to know how you're actually sitting. You can make mistakes. So in this case, maybe 90% precision is good enough. And maybe you can achieve 90% precision accuracy with 10 sensors. So you might want to do this. And this is all things you can do with your data, because you can simulate with data the situations where not all sensors are available. So that's the first. And the second is that sensor, I mean, I can't think of any of our projects where there was a sensor working from the beginning to the end. There is always a problem with the sensors. And as soon as a sensor does not produce data, it can have consequences. So depending on the algorithm you choose, you might want to reduce the number of sensors because you want to reduce the probability that the one sensor fails and the whole machine learning algorithm fails. Then there is also algorithms where you can impute missing data. There is machine learning algorithms where you can provide a specific class for missing data and this gets handled. There is different ways how you can deal with this. But this is something you should think about when you're selecting your model. So again, here, it's not just the best performing one, but it's the one that can deal with missing data and can deal with missing data in a meaningful way, such that if there is any problem with just one sensor out of 20, that the whole system still works. And then also something we are actually also fairly often involved is you need to implement this machine learning algorithms. And you might want to ask yourself, do I need 99% accuracy? But this is a model that needs a lot of computing power, so maybe cannot work on a smartphone, or maybe you just ask for a prediction and it consumes half of your battery to make a prediction, or maybe also computation time. If you have a very good algorithm but takes 5 minutes to come up with a prediction, this is not something you can provide a user with. So you see again here that performance is cool, but there is so many other things that you should thinking about that are relevant. So let's go to the learning. The learning for me, it's you need to consider the whole data journey and not just focus on the model performance. And how can you put this into practice as a, let's say, PhD student? There is one skill that you really need to do this. This is, you need to be able to work in something which is between disciplines. And this might be data science, but it can also be, I can tell you, you can have also legal perspective is important when you deal with data. How do you implement these apps so the people implementing the apps? So it's kind of like really, it touches very many fields. So the advice is to get early enough in touch with professionals to make sure that you don't miss important bits of the story. We've been involved in projects where, I can make an example. You do a model that performs very well, you implement in an app, it gets a very good prediction, but then the people implementing the app say, you're making a prediction, can you provide us with a confidence interval or anything that tells us how precise is this specific prediction? And some algorithms cannot do this. So there, in this case, you should tell them, no, it doesn't work. I shouldn't use another algorithm. So this is why you should start thinking and discussing with these field professionals much earlier to make sure that you don't miss, you know, these kind of important bits of the project. Yeah, so with this, I think it's also time to come to the conclusions. I've got 2 more slides. So machine learning is truly extremely powerful. It can multiply your output, that's certainly true, but it cannot replace what is field knowledge, what is creativity, and what is the critical thinking. So this is important. You know, I said, what is the role of machine learning? Now, actually, we should say, what's your role? And you see that your role here is still very important. And indeed, I want to take the title to say, you know, the title was, what's the role of machine learning in biomechanics? And actually, machine learning only, I mean, it brings the first one, it brings power. It is super powerful. Then the second element, precision. Precision for me here, it means how do you do things? How explicitly, how exactly do you want to do things? This comes from you. This comes from your field knowledge, from your creativity. And the last part, it's always, you know, whatever you're doing, it's important to check things. So this critical thinking, it's also very important. And obviously this cannot come from the machine learning itself. So with this, I'm done. Thank you very much for your attention. And I'm very happy to take any questions. I think we got still 10, 12 minutes left. So yes, Laura, thank you very much.
Thank you very much, Matteo.
You're welcome.
Thank you for this nice presentation.
Thank you very much, Matteo. There are any questions from the audience? You can use the question box in the meanwhile. I have a curiosity, Matteo, just a little thing. In your experience, once the algorithms have been released from your research group, they usually require maintenance in a later moment. For example, after 1 month or 1 year, it's if usually this happens or not.
It's really different depending on what you want to do. And, you know, the maintenance is something where people maybe underestimate what this implies. And again, maybe going back to the example, you should also consider maintenance. Because when you want to put something into practice, and if you know that you need to update your model very often, this is going to create a lot of work. So depending what you do, you want to stay maybe on something which is super stable, that you're not going to change anything and just runs forever. Okay. Very local, you know, very, you know, or something that you maybe can update all the time with new data, with newer methods, and so on. So it really depends on what you want to achieve, and also how much time and energy you can invest in it.
Okay, thank you, Oscar. It depends on the application. Thank you.
Yeah.
I see a question from Ursula. Say, do you have any recommendation for some free online courses about machine learning in data science?
I'm afraid, you know, I have to tell you one thing now about this. I get this question very often. And what I need to say is, like, first of all, I'm not attending courses, you know, on machine learning and stuff. And it goes so fast that I used to say, this course is very good, it's on Coursera, and then it disappeared, it's not there anymore. Or I tell you, this course is very good about a specific tool, and in 2 years' time, this course is absolutely outdated. So this is why my recommendation was more like, you know, attend courses and be curious, because you get information which is still up to date, because things go so fast that it's very easy to attend a good course, but it may be, some things are not then relevant anymore.
Thank you.
You're welcome.
There are more questions. I'm currently doing a sprint analysis using inertial sensor, particularly event detection using IMUs. I wanted to ask if you any experience in implementing machine learning in this field and any advice?
Oh, very, very, I don't know. I wouldn't be, I mean, let's turn it differently. When we meet people and we want to help, then what we actually need to do is to get the big picture. So when people ask for help and advice, what we do is first we meet for at least an hour. We get all these big picture things. This is what I meant before. You know, you could ask the same question for the sitting posture. Which is the best method to analyze the sitting posture? And I cannot answer because I don't know how you want to implement this model, what you want to do, it's a good accuracy that would be good enough for you. So I'm afraid there is no short answer to a specific topic. You would need some, you know, some more background.
Thanks. There is also a backup question of the one before, say, so where to stay updated? Like, is there any website forum that you recommend?
I think doing things, it's the best way to stay updated. So also what we do, I could look at all papers that come out and, you know, read things, but we try to do things. Internally, we do very many things that maybe it's just an internal project, but that's the best way to stay up to date. So that you really try out things, you see what works, what doesn't work, and you really are up to date with the newest things. That's, I guess, the best way, because, you know, there's simply too much information out there that places where you could look at.
There are also other two very interesting questions. I start with the first one from Madier. What kind of feature our project should have that we understand at that stage we should integrate machine learning in our work?
So the question is whether you at what stage?
Yeah. I mean,
my recommendation. Yeah. So go ahead. Sorry, Alessio.
No, yeah, exactly.
Yeah, my recommendation is really it's worth spending and talking an hour to a data professional at the very beginning to make sure you're not missing important things. So as I said, when we take over or when we're involved in projects that have been running since a while, very often you said it's a pity that we didn't discuss 2 years ago. It can be about data sources, it can be about methods, it can be about software, it can be about many things, but I think it's worth. I mean, most universities have a consultancy, some kind of consultancy teams. So just go there, have a chat, spend an hour, and then you might already realize that there is a couple of important things that you should consider in your project.
Fantastic. Thank you. I go with the next one. Based on the knee osteoporosis case that you showed before, say, like you say, the lesion do not directly correlate to pain. So what do you do understand pain quantitatively? Like, how can you understand from a quantitative point of view the pain?
Yeah, I mean, in that case, you know, you have to ask yourself, what's the goal that you want to maximize? And then I said it's patient welfare. And then you say, okay, how can we measure welfare? Now, in that field, it was very common to use pain, you know, this visual analog scale, for example, and to ask people to fill these questionnaires about the quality of life. And so this is kind of like a standard way to assess this, and this is what we did. In some cases, you can say this is not good enough because the aims of this project are slightly different, so we'd like to do something different. But in many cases, you also have to take into account the constraints. So if people are used to look at results in terms of pain and quality of life, then you stick to it. And if you want to do something new, you make this as an addition, but not substituting what people are used to see. You know this, I mean, if you do something that people are not used to, the reviewer certainly gonna tell you, why don't you do this, which is the usual? And if you put there both things, then you can say, we did this usual and we did the new thing.
Thank you. There is another question. What's your experience or opinion about adoption of well-trained machine learning model in real-time in clinical scenario? How much clinicians can relay?
I have to be careful on what I'm saying here. Let's say, if we talk about, you know, clinician and stuff, I'm thinking a lot about personalized medicine. I don't know whether this is meant there, but when you deal with patients, there is so many things that you should care about, that you check and control. And I can tell you the expectation from, let's say, the doctoral side, it's that you would just need to implement the model. In reality, just to validate your model, it needs 10 times more than what is expected. And I'm not joking, 10 times more, it's a good estimate of how much energy you should put in there to make sure that the model works well for everyone. That the model can be used in the settings when I use, that the model can be used in places where it has not been trained. Maybe you train in a country and then you want to use it over all the Europe, and the model doesn't crash. And there is so many things. How you visualize the results. I've been involved in one project where we essentially gave a list of recommendations, and what people would do, I tell you, it's pick the first one or pick the usual one. But the idea was that in this case, the first one is good, maybe the second one is good as well. So you should choose between the two first ones. So we had to then show the results in a different way. So there is so many things that can go wrong there. And because you're dealing with people, a single mistake is a huge mistake. So it's really a lot, it's a lot of work, and it's a lot of serious work that you have to do there to make good stuff.
Thanks.
You're welcome.
I don't know, Gianluca, I don't see any other question. I don't know if you see something more.
No, I'm checking.
There is a last question.
Okay.
Oh, okay, now I have it. Now I see. I think, another question. Sorry, my computer. Okay, so there is a question that say, I will start a PhD combining biomechanics and deep learning. After will it be possible for me to apply for data scientist jobs, like in sports science, even though the formation isn't in statistics or machine learning, deep learning?
Yes, certainly. So the idea to tell you what the market is about now, it's people can apply to data scientist jobs with any background, essentially. It is obvious that for some kind of tasks you really need a formal education, but then there is a lot of like mixed projects, and also it's all about the collaboration. So in a project you can have someone who's a hardcore data scientist that only mostly know the technical parts, someone who is between, and someone who knows the practice. So there is all kind of profiles that are needed. So yes, the answer is certainly yes.
Yeah, there is, I think, a last question. Say, useful model over accuracy is a wonderful insight. What has been the most surprising or unexpected insight that you've gained from your work implementing machine learning in sports in particular?
Oof, in sports. I don't know about sports, just thinking in general, and this is something we really like, I'm amazed how much value you can bring with creativity. So very often we sit down with people and say, okay, look, what we need to achieve is this. We'd like to do this and that. What is feasible? And they say, that's not going to work. I make an example of sports. You cannot get a sport on an athlete to come back and run this test 10 times. Or you cannot take blood samples every 2 seconds, these kind of things. Mm-hmm. And then you set your constraints. And then from that point of view, starting point, you wanna find a very good solution. I think in creativity, there is a huge potential. Really, you can really come up with very good ideas, which are also nice in terms of publications. If you have sexy and smart ideas, then it's a sexy publication. So I think, taking some time to think about things and brainstorm, it's a good thing to do.
Thank you. I think we can go with the last question also. Can you suggest some free or paid biomechanics related libraries that can be used to train machine learning models?
I would say that's a good question, but I would say you shouldn't look for a biomechanics specific, because one day you might be using survival analysis, as I mentioned today, and there is a package that it's the best up to date, and it's not a biomechanics specific one. So I guess it's more about knowing, okay, what method would I need, and then you just take the generic method that exists. Because if you use a super specific package, for example, in a super specific field, This means that it's a package that maybe only 100 people use. It's super specific, but it's not developed by very many people. It's not used by very many people. It only has some features. Very often people ask us, you know, I did this analysis, now I would like to extend this way. And if you're not using the big packages that have very many capabilities, then you have to tell them it doesn't work because you cannot do this in the package you use. But if you use a more mainstream one, which also evolves much more fast, then you can really use all these capabilities. Very good.
Thanks a lot. I think there are no other questions. Just double check. Yeah.
Okay.
Then,
I mean, thank you very much from my side. Was nice to be able to give this talk and get these questions, and also to see the results of the polls. And yeah, get in touch on LinkedIn, and see you soon.
Thank you very much,
Matteo.
Thank you again. And also a big thank you to the audience today. Thank you for your participation. There was something new that we have done today to have this really more dynamic webinar. So it was really great to have multiple answers from all of you. This is all for now. We will have another webinar soon. We will send another email informing about it. It will be probably in May, and it will be about grant writing. So I think it can also be interesting for a lot of us. That's all. I hope you all have a wonderful rest of the day.
Thank you. Bye-bye.
Bye.
Bye.